All right, so good evening, everybody. I have a great pleasure today to introduce Dr. Joshua Murfree, who is a COO of FDHA, Fulton DeKalb Hospital Authorities. And I am Uzma Khan, the chair of Health and Wellness of NPU-J. If I start with the formal introduction of Dr. Murfree, it will take an hour. So I would just allow Dr. Murfree to go ahead and give us a short introduction of him. And then from there on, I have very simple questions. A lot of people know Grady Hospital. A lot of people know the action of Grady. It's a well-known institute here. But FDHA, so we'll start with the first block, which is FDHA. So Dr. Murfree, after the introduction, if you can just let us know what FDHA is, who they are, and what capacity do they work, what are they doing in the community, and then what is the relation between them and Grady Hospital Health System. So I'll let you take the spotlight, and I'll try to not talk much, but and I'll let you go ahead and do that.
Good. You started off first, and let me do that for the people online who don't know me. I'm Joshua Murfree, and I serve in the role as COO for the Fulton DeKalb Hospital Authority. Actually, August 16, 2020, I've been there 4 years. Truly enjoy the work with the team that we have that's moving forward, doing some of the great work in the community and build the type of partnerships we work with health disparities. So when you think about all of that, you think about how we close the deserts on health disparities, how we close the deserts, think about education and all of that. You talk about the Fulton DeKalb Hospital Authority, who was actually founded and formed by a group of commissioners of Fulton and DeKalb counties. That's how you get Fulton and DeKalb County in 1941. They were actually given the authority to both own and operate Grady Hospital. We owned and operated Grady Hospital until 2008. We still own Grady with oversight with finance and different budgets and so on, making sure that they're all in compliance when it comes to minority business enterprises and so on. When you look at the authority, one of the most unique authorities in the country, because we have a program that deals with prevention, trying to keep people out of the hospital, which we call our CHAP program. Then we have a program that deals with community. It used to be community outreach. We changed that because when you think of community outreach, Ms. Khan, you think of a one line, but when you think of engagement, you think of tentacles. We have tentacles based on engagements, and those tentacles actually stretch out to our partners. We have been in business over 78 years, Grady over 128 years. So when you look at that partnership, what I would say what the commissioner was trying to do, sure Grady was taken care of by having somebody, not so much as tell them what to do, as oversight and help them move what they're doing throughout the country. And Grady Hospital, and most people don't know, the 5th largest safety net hospital in this country, probably serving anywhere over 600,000 individuals a year. When you start talking about 800 nurses, about 1,200 physicians of all types, some of the greatest work in the world happens at Grady, and they live by that. It's that, Atlanta can't live without Grady. I always say the world can't live without Grady because Grady is that unique. People think of safety net and they think of Grady. Yes, we take people who need insurance. Yes, people don't have insurance. We don't encourage people to come to Grady and hang out because you don't have anything, though it is an instant care facility. We want people to know they're going to get the best service. The best service is actually out there in this world. You get it at Grady Hospital. And there isn't anything, out of all the places I've worked and all the places I've gone, you've never heard somebody brag about being born in a particular hospital. Somebody might say, I've been born here, but to be called a Grady, it means something to say, I am a Grady baby. So I'm not a Grady baby. I love Grady baby. So in the sense of what's going on, Grady is that kind of facility, and they need that kind of recognition. Some of the greatest administrators in the world. And when you look at that, I think about their CEO, John Harper, with the great work that he's doing. And I don't want to start naming everybody, but it starts with John Harper making sure that everything moves and everything moves in the right direction. So we're glad to be the owners, one of the greatest uh, health systems in the world.
So, Dr. Murphy, I have a question right here. So, as you say that FDHA as a big umbrella of keeping an eye on the budget, or if you may align the budget for Grady Hospital, being that support that the hospital would need, or the healthcare, or the Grady Hospital system would need in order to keep propelling and thriving. So is FDHA the only one big umbrella, or for the sake of community to understand, or is there collaborative platform on FDHA, that there's many other entities that are part of FDHA that together run the system? Is that what it is, or FDHA itself is that one large umbrella?
Well, Grady under operation has its own individuals who handles their finances. They have their own CFO, but we just want to make sure when you start talking about an intensive care facility, nobody steps out of line trying to do something greater than we become like the big brother to say, hey, we want to make sure this is okay. We want to make sure that Grady has minority business enterprise based on the work with. There should be at least 20% of the people where we fall into that role. But in terms of just trying to tell Grady, no, we don't tell not one doctor what to do. We don't do that at all. Now keep in mind, they have their own corporation board, but a part of that corporation board are actually members too from our board of trustees. Dr. Sharon Harley is our chair. So you have at least 4 members that share that particular role with the corporation board. Not going over there telling, but supporting. And I want people to be clear that that's the support. It's kind of like FDHA says, don't mess with Grady. Allow Grady to do their work. That's a part of our job. And then a part of their job is saying everybody cannot end up at Marcus Trauma because it is the emergency. I say we need to also encourage people to go to some of the outlying centers that Grady actually own. So that's where we are with that.
So okay, so now looking at FDHA, just the FDHA,
Fulton DeKalb Hospital Authority.
Fulton DeKalb Hospital Authorities. I have great how should I put this? What you see here is made by FDHA. My first foot or step into the public health was because of FDHA giving me that experience. I'm honored and very humbled to be the inaugural recipient of their scholarship, Frank Monty Scholarship, in 2014. So what I saw, and I would like for you to elaborate on that. I saw FDHA, yes, being connected with Grady in making sure the systems are running well and all the support that it provides. But I saw FDHA doing a lot more, a lot of work in the community, a lot of philanthropic support that you guys provide to many organizations, profit, nonprofit. So if you can just go ahead and elaborate on that, because there's tons of good work that you guys are doing out there.
That's the uniqueness, and I'm glad you mentioned that. And you being in that inaugural class, you know, FDHA actually spreads, as I talk about tenants and the tentacles, they spread out in the community, close the gap in terms of what healthcare might be like. They close the gap when it comes to, I'll even say, even food deserts. And now we tap some in the education. But we want to stay around those 5 pillars that you're familiar with. Look at access to care. You look at cancer, that's cervical, breast, and prostate. You look at HIV, AIDS. You turn around and then you look at, and I always lose that right there, but diabetes. And then our plus areas, and we call it mental and behavioral health and violence. And then what we do is build our summits each year around one of those particular areas that we look at. FDHA has a broad brush type program that both long-term, short-term prevention, engagement. We go out and we collaborate with organizations that does similar work. That work says then how do we work someone who's dealing with something with prevention? How are we dealing with things that organizations is dealing with mental health? So we pull all of them under our umbrella, training with them before we give them funds. We fund a lot of those partnerships and collaborative relationships. And I tell people all of the time, and it's more than just the money. It's what we do for the people in the community in Fulton and DeKalb County. So when you look at that, people always ask, do you all give money? Well, we do, we just don't give it. We have a long-term program that falls on our DeKalb program. That long-term dollar can go anywhere from 0 to 25,000. And each year you look, we have about 31 partners that's in that. When you look at short-term, it's 0 to $10,000. Let me show you. When it's long-term, it is exactly longevity. That means those programs are going for at least a year. Whereas, and then the next year they still can come up again and actually say, I want to come back and do that program. We also now have added another program where there's a relationship between more than one partner. It's a collaboration between 2 or 3, and they get a chance to actually bid for that and go for it, try to prove to us their program belongs to someone else best. Short term, on the other hand, it's a singular, I would say, grant, a community engagement, scholarship grant that's given to someone who comes and says, this is what we're going to do, but it can be just a day event. That day event is it. Sometimes people get confused and say, well, it's just a day event. Yes, not across an entire year, but your work has been prolonged for a year, but still, that's how we get those dollar bills. And again, inside of all of that, Ms. Khan, you just don't automatically get it. You have to prove around those 5 pillars that you're actually doing what you're supposed to do to receive those funds. But I tell people all the time, whether you give someone something, they still become our partners because they like the work we're doing. Those 5 pillars in our plus areas, those areas where people come in and say to us, I want to be a part of that. What can I do in mental and behavior? What can I do with violence? Our summit this year, will be virtual, and it will be on violence. We're going to deal with domestic violence. We're going to deal with gun violence. We're going to deal with anything associated with violence. The beauty of it is going to be on October the 7th. And that October the 7th time period will go anywhere from 9 a.m. to approximately 1:30. Tomorrow, meaning July the 30th, we will be having a teen summit in the morning dealing with violence, which includes human trafficking and so forth and so on. It starts at 9 a.m. in the morning. We have some great people coming out, speakers. So please chime in to see what we're doing there. Usually the teen summit and the annual summit comes together, but because of the virtual, we're getting creative as well, which is very helpful. We just, as you all are streaming right now on Facebook, stream, we can send it out, people can see us around the world in terms of what we're doing. That's the uniqueness, if you will, of the authority here in Atlanta. Now, I know other authorities, they don't do any of this. They have 2 or 3 individuals. They just don't link out to the community. They sit at the hospital, on the hospital same area, a campus, but they're actually not doing any work at all.
So
sorry about that. Phone wanted to talk.
Okay, so Dr. Murfree, right here on, let me get a little more clearing or more definition at this point. As you mentioned that your annual summit, and I've attended plenty of those, and I'm honored that I've attended and seen you guys in action. It's going virtual. Teen Summit is virtual. You guys are being innovative too, because it's just the times the way they are. So now looking at someone who is 501c3, has a lot of had done a lot of work, and they're being just as innovative. So when you guys look at them coming to try to apply for funding, some kind of grant, how are you guys looking at this innovation or in this time? For instance, I serve the community, my boots are on the ground. I actually reach the community by providing screenings or educational event or however so. But now because of this, the challenge of COVID that we have, I'm going virtual too. So how did you guys change? I mean, when you guys look at the application, how do you guys dissect that now? Because I mean, I'm reaching the community from different channels, different mediums now. I might be unable to provide the screenings or have that one-on-one with the community members. Mm-hmm. So how is FDHA formulating or changing the dissection process or saying, okay, it's all right or it's not all right? So how are you guys doing that at this point?
You know, in research, there's a term called operationalized. So we try to operationalize what people are doing, right? You have to start thinking about the application. You don't have to pay for a venue. You don't have to pay for transportation. You don't have to pay for consulting. You don't have to pay for some of those. You don't have to pay for things. But then you start saying, how creative are they? Are they actually doing any screening? Just suppose we had someone say, well, we could do some telemental health or telehealth some kind of way. We look at every aspect of that, Ms. Khan, in your question, because we get that, and when we look at the application, we have to say, well, if you requested 10,000, now it's not going to cost you that much. Guess what? Just suppose you say we get to be creative, and of the 200 people we're going to reach, we're going to send out 200 packets of educational material by this date that might have some PPE equipment with it. So as they're getting creative with the virtuality of what we're going through now, this current norm, I won't call it a new norm. I think anything that happens in time as a zeitgeist of the spirit of the age, it is a current situation in. So the current normal we're in, they've adjusted and we've adjusted. So we have to say to them, and we often say, continue to be safe. Don't just try to get the money and say, well, we're going to space and socially distance people. We know human nature is people are going to come together. So we say to them, we're looking at the material you still need. We know that you're not going to go out there and screen any health face-to-face. You know, we're not going out there doing COVID testing, but we might have some who actually go out and help testing, especially like in the health department. So we don't have to be as creative because they're still seeing people face-to-face. But other programs were saying, because of the pandemic, this is what we're going to be able to do. Because of the pandemic, we'll still be able to reach. And let me show you as a classic example. Just suppose you were doing something, and it was Khan Associates. And Khan says, I want to reach 500 to 1,000 individuals. Well, we've also studied that. If you want to reach 100 individuals, it's like $14.95. It could be free if it's 40 or 50 in Zoom. If you want to reach 500, you need to spend $1,450 plus taxes. So we know that you would qualify for at least $450. Suppose you were reaching 500 individuals at 25 packages piece, you start multiplying that, that ends up something like 2,000. And so now you got $3,725.50. Somebody's saying they're trying to calculate that, but no, it would be in that particular range. You can say, oh, I see now. So it's not all on deaf ears. We're not just saying because you're going virtual, you can't do this. But believe it or not, more people have been reached virtually sometimes and in a safe manner than having to travel, having to get on the bus, having to go out of town, having to catch an Uber, and it's working. And we still get a chance to connect. You see, when you think about it, I'm meeting people that I never met before. I mean, I know you, met this young fella early on. It's like, how do we move and be creative what we're doing and still get it done? And this is how it is. Now we get a chance to see, we still email, we still correspond, we still educate, but we have to move forward. This is where we are in this current normal. And so that's what we do. I know I went a long way explaining that, like I was a president of the United States or something, but it's like you have to understand we still want to help. We just don't pull back and say we're not going to help you because you're going virtual. Because this world is going to stay virtual for quite some time. That's just my thinking, because we won't stay at home so the virus can go away. We're still having huge gatherings. And FDHA would say to people, don't do it. Listen to the sciences. Study the sciences. I know people want to say, well, we shouldn't wear a mask. Well, I'm in a room by myself. You're in a room everybody's in the room. Okay, that's good. But if another person walked in that room, in that space, who could have been outside because asymptomatic behavior, then they should put on. It's okay to put on a mask. I tell people, I treat it just like a seatbelt. You should wear your seatbelt. It shouldn't have had to be mandated. All of these years, these cars put a seatbelt in the car for a reason. But people had to be mandated to wear a seatbelt, and it saves lives. And so on. So it's the same concept here. It saves lives when you put on your mask. I know you didn't go into that, but I had to take you there with some of the things we're doing and being creative.
That's beautiful. So now looking at giving back to the community, however, so there's another tier there of FDHA, which um, supporting youth by offering certain internships, certain fellowships. So FDHA has that another segment, which is beautiful. And I'm honored again that I was part of it a long time ago. So if you don't mind elaborating on that a little bit, or a little bit of quick talk on that. So people that don't know yet would be able to understand that FDHA is, yes, all about community, but at the same time, how important education and in grooming the youth for future is for FDHA as well.
And the relationship, and this is Dr. Carrie Norris's house, I would say. She's been doing this for quite some time, and what we actually do now is look at either 4 to 5 interns, other programs, and Frank T. Monty program is one. And when you look at this, we bring in people who work on their bachelor's degree, and usually in public health, or their master's in public health, such as epidemiology, biophysiology. So they'll bring those students in. And so we actually go through a process, an application process. We'll bring them in about 5, and we do it for all semesters. We do it for fall, we do it for winter, spring, and then also for the summer. We just finishing our interns, and they got a chance to do it virtually, their presentation, and we actually give them funding. Or you can take a grade for that particular work, and it works out well. That's our way too of educating, of training, research, community engagement, and also mentoring. So we'll continue to do that whole piece. And it's been a wonderful piece to see young people. And then you're being that one of the first products, look where you are and look what you're doing. That's what we plan on doing when we work with young people. The other pieces you'll see are the second piece, like working with groups. And let me retrogress for a minute and go back to the interns. Those interns can come from any university or college. We at first we used to look at anywhere in the country. We try to do it in Fulton and DeKalb. When you think of Fulton and DeKalb, you have to think about private institutions in this area. In Atlanta, you have to think about the University System of Georgia with over 26 universities and colleges. So they can come from anywhere in the state. They can also come from other places. Now, the thing that we looked at, suppose you are a student from Fulton and DeKalb, but you're at Harvard, you be considered because your native area and residence is in Georgia from Fulton County, DeKalb County, Atlanta City, so you can actually be seen in that. Because in the past, when we started doing that and we put it out nationally, we had a lot of applications from everywhere. So what we tried to do is just kind of filter that a little bit more. A great program. The Teen Summit, on the other hand, is how we reach out to mentoring programs. How do we reach out to programs and all to get our teens involved? We have been very successful at our previous summits each year. That is something great. We will continue tomorrow. You'll get a chance to see some of them on the panel.
So for the teens, for the Teen Summit, this is very innovative, and I think it's sort of new that you guys have started. Are you guys targeting high schools in order for it to be a teen summit? What's the recruitment process? Because in our NPU-J, we do have certain schools, and we would like for our students to understand that this entity exists and they have a chance to apply and to get hands-on public health and for future whatever you decide to give back to the community as. So if you don't mind telling us that what grade level and what's what are the fragments or the sections of you guys attracting these students from the community.
Right, for the people listening online, and we had to be sure someone can be actually, when you say teen, it's teen, 13 and above. Whatever that child falls in that particular grade level. And then I'm going to explain why 13 and above, because I do a lot of mentoring nationally, internationally for 100 Black Men of America. And a lot of people actually miss this. They miss this for this reason. They're trying to get people to be on a panel. They're trying to get teens involved. They're teens, and sometimes they might get a child. But we do use schools. But we use partnerships. So we ask our partners, do you have young people that want to be on this? And that's what you do. Because if you're talking to the adults and you're talking to the teen, to make it fit right, then it goes to the community when you're talking to the adults and the teens from the same community. I actually warn people from April 2000, there is a law, and it's called the COPPA, C-O-P-P-A law, Children Online Privacy Protection Act, COPPA. And a lot of people don't know about that, but they actually, if you have a mentoring organization or you're working with teens or you're talking to teens, anybody under the age of 13 must have the consent of the parent. Like what we're doing now, we should not have an 11-year-old in this conversation talking about something unless their parents were online and consented to you to do this. And I want people in this community and everybody on this line to listen to that. You might say, we're doing A, we're doing B. And I'm also saying that under FERPA laws and laws with family and so forth, Family Act, because what you're gonna find this year, because of the pandemic, you're going to find people who are in elementary school online. So school districts need to hear, if you're going to do that with my child, because I want to make sure that the person that my children are dealing with are actually from the school. They're actually the board certified, qualified teachers that's talking to my child. Because if they don't monitor that, those children, and you know, people are doing a lot of things too that I won't try to describe in this conversation. But truly, that's how you safeguard the life of children, and it's called COPPA, Children Online Privacy Protection Act. If I'm not mistaken, it came out April 2000. So don't get mad if I missed that date. It actually was presented before then, back 1998, and 2 years later, they actually got it all fine-tuned.
So, for instance, in our sector, our schools want to come in partnership with FDHA, and let's say they have there is a mentoring program that is in place, but it wants more exposure, it wants more of a guardianship, if you may, to come under the umbrella of FDHA. How should we guide them to reach you guys? What will be the simple steps for them to come forth?
Oh, through their just say it's not with a partners that we are not with any of our partners they're already working with. Just say if it's not with any of our partners that we're already working with, all they do is make a contact to our office and say they want to be a part of that, and they can call us 404-489. And I'm gonna make this real easy for everybody. 1234. 404-489-1234. They can actually do that. They can actually go to www.thefdha.org. And some people might say the, but it's thefdha.org. Describe what they want to do, and we'll have somebody from the team actually reach out, get with them, have that conversation, and so on. And that's good when teams want to come in, because we work, and our whole role is work and train through partnership, train in terms of what we're doing. We're all on the same page. And that goes back to when I was talking about the grants. We now have short-term training with our grantees, so they clearly understand how to distinguish between long-term and short-term, and more importantly, how to apply just between community engagement grant and that of a grant that they actually work in the time period. So all that's there.
So is there a quota for the teenagers per year? Is there a quota for interns, undergrads? Is there a quota for fellows, for fellowship?
Quota in sense, and let me understand when you say quota, I don't know.
That means a certain number is only that you guys can take as a new partners, or as when I'm talking about teen, I'm just saying that, okay, every year, for example, you have only 5 schools that can participate, and total number of teens that can be part of it for the mentoring program is X, Y, and Z. For the interns, is there such, and same applies for the interns that are undergrad, for whatever multiple scholarships that you have or internships that you guys have, that there's only certain number of interns undergrad that you guys hop on board each year or each semester, and then implementation the same way for the fellows that are doing masters. And
that depends, Ms. Khan. We can get a 3-2. We can get a 3 with undergrad and 2 with the masters, like what you're referring to. And then yes, if we can't get a fellowship, sometimes we'll have that conversation with our executive team and say, should we do 5, and can we do 5 all undergrads? And we can, because we try to make sure, because that funding, we actually want to use that funding for those. Now, you mentioned When we do our summit, yes, we do limit that. We might limit that based upon what we're trying to get. If we're looking at a summit for 500 individuals, we might look at that summit too, for anywhere from 150 to 175 youth across Fulton and DeKalb.
Okay. So now moving forward with Grady and the challenging times that we have, but hold on just a second before I move forward to that. You mentioned about your summit, your yearly summit that is happening on 7th of October,
Yes.
2020. It is virtual. Is everybody invited on that summit? Or is there any limitations on that? Do you have to be part of a profit, nonprofit, or any organization? Or can community members be part of that summit or attend that summit? If so, what is the process? Where do they go? How can we get that invitation out? And we'd be more than delighted if it is possible for us to post it on our website and our on social media as well, so our community can benefit from it. So please.
Yes, and we'll make sure you get that information, and we thank you for that. We really do. Anyone can come to the summit. That's what the summit is set up for. What we find in the summit, we get volunteers that come from our partners. We get people coming from the partners because of the fact we decided to do this. When I first came in, we used to see partners not being there, maybe because of people and so forth and so on. And if we fund you, we want at least 10 individuals to come to the summit. We had to break that down to 5 because we almost started getting overload. So you start multiplying. When we had 60 partners short-term, 30 long-term, 60 times 10, so you're already at 600. So we had to say, no, let's do 5. Then we got creative again, talking about the creativity of FDHA. There were individuals that we were from partners after the summit in October. So if you got money after October the 7th, what did you do? We say, now you will be required to bring 5 to 10 partners to our community. We used to call it follow-up forum. Now we call them our community engagement forums or community conversations. So they'll come from either January, February, and March, depending on the location. Whether it's Fulton County, Atlanta City, or whether it's in DeKalb. So we started doing that to kind of let people know, if we are in a collaboration and you get a chance to get funding for what you are doing, it's only fair that there's a level of reciprocation. And that's what we say. You reciprocate, we give you grant. We're not buying you to come in. You're already doing the work. Since you receive the fund, please come in and be a part of it. There was another part of your question that I might have missed in terms of that.
Well, you said everybody can attend, so which is great. Now, how do they do? The invitation is not necessary. So, is it a straight website visit, or is there anything else that we need to do?
What we actually do when we get ready we are ready. We'll send that information out. People will see it and we'll tell you to come to our Eventbrite site, register, and you can register. So we use Eventbrite. To keep all of our great partners, we have something called constant contact. And when we looked at it, we must have over 4,000 or 5,000 individuals with our constant contact. And a constant contact, if anybody is using that, I strongly encourage you always do a sweep. That sweep means go through and make sure the emails and the phone numbers are still up to date. What we did, again, creativity, we actually started categorizing them. Like we categorized them based upon health, based upon diabetes, based upon diabetes, based upon cancer. We started doing it like that. So we'll know when we're looking at those particular names. Also, elected and appointed officials, we kept all that education. We did that for our constant contacts. But when it becomes an event, we use Eventbrite to do that for us.
Okay. So I would like to get, of course, the basic information, and I'll.
You will.
So we can post it and have our community also participate in that. So now moving forward, one step forward towards Grady and challenging times. Grady has been great. You know, I just don't have enough words. However, so you are right there in the system, and you've seen Grady reaching out to the community, and I'm talking in particular with COVID. What different, or what have Grady done, if you don't mind shedding the light not in too much depth, but however, so what is out there, because our community, our sector, our people, they go to Grady. They have a lot of ties with Grady, their families, the location of the sector and everything. So please help us understand and that what is there if our community members need help from Grady to reach out, particularly in reference to COVID, and then of course overall. Some have insurances, some don't. There's certain taboo, there's certain word that's out on the street, what's right, what's not right, but we have you now, so you can actually identify that what is the process and what's Grady offering, what changes have Grady brought to serve the community in COVID times.
Being that I'm not employed by Grady, being that we own Grady and not operate Grady, I tell people all the time, it's a hospital like any other hospital, but I have to give them credit in terms of what they're doing. I read the news from their CEO about what they're doing related to COVID, like other hospitals. Grady has reached capacity. I mean, the numbers are increasing. It's really tough out there. You just can't run to the emergency room and say, I got COVID. You actually, like anyone else, need to call in, make an appointment, try to get over there. Because Grady is run by pods. They have different pods where they actually go in and treat. Too often people would think, well, I got COVID. This is where I go. Should be tested. There are other screening places outside of Grady Hospital to get that screening. I mean, they're all out there online, and I suggest people do that. They cannot expect Grady or Emory or everybody to handle everything that's going on, because they're getting calls as far away as Navison Health in Macon, as far away as Phoebe Memorial Hospital, both in Americus and Albany. So all of those hospitals are trying to get people to Atlanta, and they're calling Emory and Grady. So what they're trying to do is balance those numbers, but also at the same time make sure that people's lives are taken care of. But when you say a hospital capacity, they're at capacity with beds, they're at capacity with certain things in terms of the doctors and nurses, but they actually don't stop trying to treat individuals. When you say something new, Grady is consistent in terms of what they're doing and what they're trying to do with this COVID. I mean, no one really has the accurate answer to that. We actually have more questions about COVID-19 coronavirus than anything else. So Grady's whole piece still push forward. I mean, their staff is over there working. I'm going to walk, but I'm not over there checking, because that's not my business. It would be outside of my purview to do that, but I keep up with the news that comes out from the CEO. Then I send that to our board about where we are. I just read that data today, that we're continuing to serve, we continue to do as much as we can. Grady continues to look at the sciences, and those sciences can be memory. The sciences could be what they're doing with Grady, and they're great people. The sciences can be WHO, Health Organization, the science, National Institute of Health, all of that, and the Centers for Disease Control. So they're taking the time to look at all of that. They too study the science. Can we do? What are we doing? What are we using? The other piece that I'm quite sure that Grady looks at, as well as the FDHA, is the information from the CEO, Earl Rogers, his team at the Georgia Hospital Association. Where are we? What's happening? Are we running out of equipment and supplies? Yes, you see a lot of that. So Grady tries to make sure that their staff are well supplied with everything they need. Grady is continuing to be the great hospital that they actually, and all the services. So they're using their centers to make sure all this is happening. But I tell people this, before having to come to Grady and any of this, listen, I never forget when this hit about 4 months ago. And there was a report, and I'm trying to find it. The guy from Italy made the comment, we're going to have more of a difficult time with the United States than any other country. He says one day, and he put it in perspective, he said, one thing in America, you'll hear, I am grown. I am grown. So it's hard to tell us what to do in America. Sometimes we won't listen. We won't follow the laws. We won't follow the rules. We won't do that. And we try to politicize what we're supposed to do. So we fight, and there have been a lot of people. Here's some of the superstars. We continue to hear politicians getting sick. But we take lightly just wearing a mask, just washing your hands, just doing that, covering your eyes, covering your, whatever it takes for you to live, then you should do it. Asymptomatic, contact tracing, all of that's important, but it's important in a sense, just like somebody asymptomatic. When you look at it, someone walking in the room that started early on could have it, because one thing about COVID, unlike anything else we've dealt with, everybody on this line tonight, everybody's symptomatology can totally be different. Mine. I might look around and say, there isn't anything wrong with me, but I'm like typhoid fever Mary. I'm the carrier for whatever reason, not trying to be, but it could be the case. Whereas somebody else can be completely healthy and all of a sudden they've been in the hospital for 15 days. But let me say this too, and I don't fall in the realm of being a pharmacist. I don't fall in the realm of being a epidemiologist, but I can read. One thing that I have been following that's been helpful to both family and friends, and I've looked at information from GHA and also from Grady, is that the medication that being allowed to be tested and used right now, you need to look at, it's called remdesivir. Remdesivir is a medication that hospitals are looking at and using. It's a trial that they're doing. I'm not an expert in it, but I understand that right now it's the crucial one that people use because it is dealing with upper respiratory. Doesn't mean it's going to work, but it's doing a lot better. Dr. Fauci talked about it. When you look at 15 days versus 11 days in the hospital, he said for all of the scientists who understand the alpha level, he says when P is less than 0.0001, that means it's significant. He said, but the ethical side of all of this, they're seeing the change in the days of hospital, 11 days with the remdesivir versus not having it 15 days with your groups. Now watch in the research group, Ms. Khan, when given the medication, he says there's not a significant difference in the people living. And he says that's the thing that they're working on because, thing of the sort, and let me use it like this, as you're hearing it, the thing of the sort when it comes to treatment. That means, though, the ethical part, if you have a placebo group, a group that's not getting any medication other than a sugar pill, and one that's getting here. Say you had 10 people and one person lived because you gave them disability 10. You didn't give it over here, but because it worked with one person, ethically, you have to now give it to that group. And you're trying to do the generalizability of it because it might not work. It could have been working with a person who had the worst symptoms all in that 10, but because you use it on that 10 and it saved one of the 10 life and the others passed away, you now have to still use it on a group that didn't receive anything but a sugar pill or a fake pill. And that's just research, ethically doing what's right. I like it. I've read it. I've studied it. And it's not me. I'm not licensed to prescribe medication, but you don't have to be licensed to talk about it and look at it because I've also studied where the medication is being placed in different hospitals throughout the country, different counties throughout the country. So you would hope that administrators at these hospitals are saying, please consider the medication because right now, if you can decrease the days in the hospital and it is significant, even beyond the 0.05, 0.01, 0.001, 0.001 as Dr. Fauci is talking about, who's one of the greatest epidemiologists in the world, we need to listen. That means I'm not as sick about a 15th day because of and I use the medication. And people need to live because to me, that's saving lives, that's saving time and so on. So we are seeing the whole death toll going down, but not the number of people. And some of that has to do with the attribute of more and more people being. So go back again, Grady is that a hospital still that's working hard and handling and understanding everything that I'm talking about right now.
So on the subject of the medication and research and all, and you don't have to answer this if you choose not to, would you comment on anything in regards to the vibe out there about immunization that is in regards to COVID?
Depending on which vibe, I've seen some vibes that I don't probably want. As I've seen some organizations that would say don't take a vaccine, and people will hear me on this line say that when you start saying different groups, regardless of race, color, sex, religion, and national origin, it always comes up for African Americans and minorities. African Americans, of people of color, we always think about the Tuskegee study. We've seen studies that say, well, if we're doing this, why don't we do the study in Africa? And then their prime ministers are saying, why you gonna come here? We're not gonna be getting. People have to be careful when they say, who will the study be done on? Which is very, very important to me as a person. And when I think about the human race, why would you pick a particular race of individuals to do this study? You have to be careful. Do it in the lab. Come out the lab and say, here it is. Keep it up with that. Pfizer has been given $1.92 billion, almost $2 billion in a queue for this to find the vaccine. People must know if the vaccine given when they find out doesn't kill you, every vaccine is going to have a side effect. If you look at any kind of medication you take, you're going to actually find 4% of any population get some of the worst of the side effects. And hopefully it's not death, not being paralyzed, but you find that in some of the simplest medications that we take, things even across without being prescribed. So we really have to be careful, and we have to be careful saying which group of people. For that matter, it's interesting how the Humane Society has evolved for many years. Don't just grab an animal either. You need to finish this study in a lab, as they say, in a laboratory before you get out back trying to do that. So I do stay and I read a great deal about it because it's very interesting. Somewhere it's out. Somewhere it's out there, there's an answer. But in saying that, let me say, not stepping on anyone's toes, I'm a Christian. I read the Bible a lot. Matter of fact, I'm sitting right now with, I was doing the presentation last night and I have my Bible commentary. What was it meaning to look in certain books of the Bible? But I tell people all this time. And if you're a believer, you go to Isaiah 26 and 20. It tells this entire world. Isaiah 26 and 20. And if I tell people what Isaiah 26 and 20 would do, I've been a professor too, full professor within you, they won't go read it. They'll say, this is what Murfree said. No, what the Bible says to everybody what they should do. This is the answer. It doesn't tell you to wear your mask. It tells you what to do without wearing a mask. Not just praying. It tells you what to do. Sometimes, and the simplest part, back to the guy from Italy, if we've done what they were done. Look what 0 cases in New Zealand, because people are doing what's supposed to be done. Instead, look at what's happening. Our beaches, you have to close the beach to keep people. You have to close restaurants. You have to do this. People are not listening. You have to listen. And I tell people the best way, if you're going to help yourself and help this world, give me a second to say this. We'll go back to what you're talking about, is that you can't always listen with your ears. It'll go to your head too fast. You find an answer, but if you listen with your whole body, it'll go to your heart and you can tell somebody else. In our profession, we've learned how to listen with our entire bodies. So to go to our heart, make that difference.
That is so true. So true. It was a pleasure, Dr. Murfree, to have you on NPU-J platform. If there is any questions, Kiona and Ben, please feel free. And Dr. Murfree, you too. You're not here for all the answers. If you have any questions, please feel free.
This is Ben. I had a couple of questions. First one, are you seeing any sort of financial pressures due to the COVID-19 that you weren't anticipating?
Am I seeing any?
Yes.
As a person?
No, the organization.
No, the organization is, we had a great plan already centered around it. We actually seeing a decrease in what we do, what we use, how we do it. You don't have to worry about parking. You don't have to worry about jumping in an Uber or doing any of that. So you see a decrease in that. And we have been blessed not to have any layoffs, anything like that. We're actually going through our budget right now to make sure we're prepared for next year for what we will use for the summit. This year we'll have to worry about it because it's virtual, but we still have to prepare for the 2021 budget, which is a great question. And people need to be ready for that because this is a great change. And don't let people sell you a wooden nickel out there because you're virtual that it's going to cost you this kind of money to put on it. Zoom is great. It's not costly. Like I say, it goes up from $14.95 a month, so $1,450 if you have 500 or more individuals. So it's been a cost neutral situation with the authority. Now, if you ask me that for Grady, I would say yes. It's been costly because equipment is costly because of the number of patients they're trying to see. It's been costly and so forth and so on. All of those numbers will come out in average. I must say, I think the whole United States of America are getting together, the House and the Senate, to vote on the CARES Act because their organizations have actually received funds. I think it should be more. I think it should be a better analysis. I think when you look at the banking and you look at forbearance opportunities, I think they should do it again. I think they should really do it again, and I don't think people need to rush to work. If an organization had 10 employees, this is just Joshua Murfree's thinking, at 10 employees, and those employees they're all receiving over a year period of time, say $50,000. The United States should give enough money to that company or to that business to pay those individuals that money. Because if they go to unemployment, this is when you're gonna see that rate unemployment and get benefits. You're gonna see that. But they couldn't choose to go there because the money's coming in. Now I don't want people double dipping either. I don't want the banks or anyone to double dip. I want them to get money and don't give me forbearance. They give me forbearance for 3 to 4 to 6 months away from my mortgage. That's great, but don't come unless you take my mortgage and tax it to the end of my mortgage payments. I don't take, and I've been reading and studying that too, because y'all can tell. But don't tell me you have to pay it all back in a lump sum. You can't play with it. You got to be right. Because $3.5 trillion is a lot of money. It's not a small pocket of change. So that's it. You had another question.
And the next question I had was, you were talking about the virtual summit and being able to reach people easier and whatnot, but have you seen any service level impacts with certain segments of the population due to a digital divide, people that don't have access to internet or phones very easily?
You do. As a matter of fact, we have worked with some great organizations like the United Way. When we start talking some of our team, when you're just asking, we work with Sprint, we work with Verizon, try to make sure that some of those segments and sectors of the community actually at least get something where they have hotspots, where they have computers, where they have internet and Wi-Fi in their homes during this time, and will continue. Yes, we're getting a chance to see that, and more. That's why some of the schools and colleges and universities cannot afford not to open their doors, because guess what? They didn't have the infrastructure. They didn't plan that some of this would occur, regardless of whether it's a historically Black college and universities to a local college, private colleges. They all had the same problem because they all think face to face. They all think we have to be there. But it's interesting with social media, somebody should have thought about this anyway. What happens if something like this occurs? How do we get out there, people, all the time? What happens if your computer doesn't come on? And how would you communicate with a family member in Jacksonville, Florida? What happens if you only had the United States mail? What happens is that you should pick up a pen and a sheet of paper and write them a letter. Too often we don't think like that no more. We think about, man, we got email, we got text. Oh, just suppose text was taken away from you. You ever seen that? People lose their mind. Oh man, my machine is down, my text down. How we go? And the guy come to your house to repair it. He said, mine down too. I don't know how you got in contact with me. Well, I picked up the phone and made a call. Don't pick up the phone and make that call anymore. And I told people, when you mentor young people, to answer your question with some of our mentoring programs and virtual mentoring, whole organizations, pick up the telephone, call that mentor, pick up the telephone and call a friend. Even though you might be able to text, if I wanted to text, I can text you or text Ms. Conlon, text Ms. Jones. I should pick up the phone and say, hey, how are you doing? How are you really feeling? And you get a better feel from that person. Because we start relying on things that's so convenient. It is so convenient to text, so convenient to email, but I go to what if? Merrill Lynch used to ask that question. What if? What if this occurs? And that's kind of like we have to think. I remember when I was a school superintendent, when they were introducing me last night, people came to me. They said, what made you think about a virtual classroom in 2010? Well, I thought about a virtual classroom in 2010 because you had so many children now, people want to homeschool. One, for safety reasons. One, for convenient reasons. That take dollar bills out of the school for the children who were there. So I said, let's do a virtual school. They take one class, just one. I would still get a chance to get my equalization funds, and I could count at my data bar in October. So I was trying to think like a business person. I just didn't read educational books. I read business books as well. So people need to start thinking past this pandemic. And my thought right now, your question, because you asked a great question, you're going to have influenza that's going to hit children in school from August to October. And with the COVID, do not, people going to open their doors. Who am I? I can say, but I would not open the doors until January 15th, 2021. I would send people home, and I would send people the type of stimulus check that would take care of this nation of Americans until then. Sit down. We should never have to have a mayor in cities, right? We should never, thank you, should never have to have a mayor in cities that have to tell people, yes, it's a mandatory mask. We're grown. See, I told you, I am grown, but you are grown, but put on that mask to save life. If you don't want to be saved, at least think about the other person who really want to take care of their life. And it would change. I guarantee you, we had on our mask now to January the 1st, 2021, you'll see COVID leave itself. So the best answer to defeating COVID is to destroy COVID by following some of the simple things. Wash your hand, do all those things, cover your face just for that period of time. But instead, we won't do it in America. It's gonna be tough.
So true. So Ms. Jones have a question, it's a question / request. I mean, we obviously, as I mentioned earlier, it was a pleasure to have you, and we would like for you to return on this platform again. So it will be our pleasure, furthermore, to have you, for us to be partnering with FDHA, because I mean, again, we are serving the community. We'd like for NPU, Sector J, and eventually all the other NPUs as well as, to partner with FDHA on different platforms. I mean, you guys are offering such an amazing grassroots work and supporting so many things out there. Not only Grady, but there's so many other things in the community, from youth all the way to health. So you will hear from us. I mean, you know me, Dr. Murfree, I start and there is no ending. I will definitely email you and connect, particularly starting with NPU-J and moving forward. As a health and wellness chair, I know there's a need in our sector, and together we can work and we can build this community towards betterment and educate our youth and plug so many things into the system with each other and many other organizations that are on our platform right now in order to come and reach out to FDHA. So this was a request / I'm just saying that I'll be doing this, and I'm hoping that and you've always been very supportive. Yes, so I mean, the other NPUs, we want other NPUs to get this information as well. I mean, you disseminated amazing information on this platform today, and we want all the other NPUs, there's 25 of us together, to be informed of the presence and an amazing work of FDHA, management of FDHA, Fulton, DeKalb hospital authorities, and amazing work of Grady that is attached. It's a huge entity. It's a landmark of Atlanta that is attached with FDHA. So we will be inviting you on repeatedly, I guess. I wouldn't say one more time, but I guess repeatedly on the platform of NPUs. And I know you have a busy schedule, but I'm hoping that you will make that the hour or two for us moving forward. So like I said, it'll be multiple, Dr. Murfree, not one time or two times. We will return. You will see my emails many times. So thank you so much. And if there is any question on your end in regards to the NPUs and the functioning of NPUs, we'll be more than delighted to answer. we're more than delighted to answer any concerns, any questions, anything, you know, or you just simply want to know. I mean, I've got Benjamin and Kiona. Both of them know it very, very well.
I was waiting on Ms. Jones. I didn't know whether Ms. Jones had a question. I'm pointing like she wanted to ask.
Well, actually, my internet is unstable at home, so I was entering all of my questions in the chat, and I'm just a little disappointed because you're giving out this great information, and it's only like the three of us here. So I got some strategies that I'm going to use as far as like marketing is concerned, so that we can have at least 100 people, you know, on this call.
It's sent. Ms. Jones, it's okay. You don't have to be. He's actually streaming it Facebook, so people on Facebook can see it. But the beauty of what's happening right now is I was talking about Georgia Hospital Association and Earl Rogers. He just sent something out making a statement about the urgency to get more supplies to hospitals, and also now, Ms. Khan, the urgency to try to deal with this surge that the hospitals are having, because now people are trying to transfer everywhere. And that's why Grady said, look, we're at capacity. It's not that we're going to turn people away, but we're at capacity. You're at capacity in Macon, you're at capacity in Americas, you're at capacity in Phoebe Putnam Memorial, you're at capacity in Fitzgerald, Cordell, right on up the interstate, right on where you are. So when you start looking at that, they are trying to figure out now a strategy how to handle all of this. Again, I must say, I want each of you, I don't know your beliefs, I want you to spiritually go and read Isaiah 26. Isaiah 26:16. It will give you that answer. Again, thank you, NPU, historic West Side Atlanta. I'm honored to be here with you all today. I really am. Thank you so much. Isaiah 26, verse 20.
Okay.
I see you say Isaiah 26. Here it is, Isaiah 26, colon 20. Okay. All right.
All righty. Well, thank you, Dr. Murfree. Everybody,
Thank you very much.
Wonderful evening. You will hear from us again, and we would be more than delighted to have you back on NPU platform.
Hey, I do it for you.
Thank you very much. Thank you.
You're
so
lovely
much.
people. Thank you. Take care now.
Yep,
All right.
All right.
Thanks. Bye. Oh, it was good.
It was good. That was good.